Please join me in welcoming the only man who has beaten both Labour and the Conservatives here in Rochester and Strood. Not forgetting the fact he also saw off the Conservative Mayor of London who wanted to build his bunkers airport on the Isle of Grain. So please put your hands together for UKIP's respected, experienced and independent parliamentary candidate for Rochester and Strood, Mark Reckless.
Ladies and gentlemen, thank you very, very much indeed for coming this evening. We brought back the good weather. We were very lucky at the by-election how it was, but we've now got light evenings as well, and I'm delighted that you've chosen to spend this evening coming to hear us at the Rochester Corn Exchange. So thank you. I would also like to thank Chris Irving. You've heard from Chris just now, but Chris, as well as being our candidate in Rochester East Ward and a sitting councillor for Peninsula Ward. He is the leader of the UKIP group on Medway Council, which has recently doubled in size to 4 members, and we hope it will be at least doubling again and hopefully rather more in a few weeks' time. We're already the 3rd biggest group on Medway Council. But Chris is also my agent for this election while doing all his own campaigning as well. And he's also my office manager. So, Chris, I owe you a great deal. Thank you. When I spoke in this hall at the by-election, some of you may have been at that event, many of you may not have been. But I remember making 2 promises in particular as to the issues that I wanted to focus on if I was re-elected as our Member of Parliament. Now, the first of those was backing Medway's NHS, and in particular, bringing improvements to Medway Hospital. The second of those issues was Lodge Hill, and fighting the Conservative plans to build over 5,000 houses in a bird sanctuary. Since I made those promises, we've had, I think, positive developments on both of those fronts. I'd like to talk first about the NHS, and then I will move my remarks onto housing and some of the issues that we are doing there. On the health service, my mother was a nurse. My father is a doctor. I was brought up in the NHS. My parents met working in the NHS, and it is central to my values and who I am as a person and as a politician. For UKIP, the NHS is an expression of our patriotism, something that brings us together as a country, a system of mutual insurance where the better off look after the less well off, but also those who are unfortunate and happen to get poor health and illnesses that may often cost a very large amount to treat are looked after by those who are more fortunate and don't develop those illnesses. That is why we support it. It is also why we want to abolish one of the most iniquitous charges, not just in the NHS, but in the whole country. And it's a tax on illness. The more you go to Medway Hospital, the more often you will pay it. And I'm talking about hospital car parking charges. The more you visit, the more your family comes to see you, the more chronic the illness, the more you end up paying. It is completely opposite to the principles of the NHS because it cuts across the grain of why we have an NHS. UKIP are pledged to abolish hospital car parking charges. And when we make promises about the NHS, there is actually the prospect that we could deliver them. Because unlike the other parties, we have sources of money which we can redeploy onto domestic priorities, and particularly the NHS. First of those is our overseas aid budget, which is now in excess of £1 billion per month. Now, we don't want to completely end overseas aid. There are aspects of it which we support, particularly inoculations to try and eradicate diseases, basic sort of water and sanitary care, and also the disaster humanitarian relief, where the role of governments and their ability to deploy navies and logistical support very quickly is important and save lives. Those aspects of overseas aid we will continue to support, but we would like to spend about the same proportion of our GDP as the United States. We would like to spend about the same amount in absolute terms as Spain and Italy put together. But that would still mean finding savings of approaching £11 billion a year by the end of the next Parliament. And one of the key areas where we want to spend those savings is on the NHS. We've said we believe it needs at least another £3 billion per year. We've set out plans to hire 8,000 more GPs, 3,000 more midwives, and 20,000 more nurses. But we've also got ideas about practically how we make the NHS work better. For instance, nursing as a profession, we do not support the requirement for everyone to be a graduate who becomes a nurse. We think there is scope for that more academic path into nursing, but we believe that compassion and caring is the most important aspect of nursing, and it should at least be possible to train on wards, rather than remaining a low-paid medical auxiliary. People who are developing that experience should be able to take a nursing course on the wards so that over time they can qualify. And for that reason, we would bring back the state-enrolled nurse. It takes a long time to train GPs, so even if we do have money that others don't to deploy, we cannot create new GPs overnight. But what we can do is encourage people who've already worked as GPs to come back into the workforce and to once again treat patients. There are many doctors who have done training as GPs and experience as GPs, but for one reason or another have left the workforce. Often they may have a career break. Very often they may be women who've had children and decided to stay at home for a number of years with those children. What we would like to do is encourage those people back to work. At the moment, if someone in those groups wants to become a GP again, they need to revalidate as a doctor. They need to go on a whole series of reinduction familiarisation courses and a whole series of regulatory hurdles they need to clear. Now, some of those hurdles are sensible, and to make sure that the doctors are skilled and able to treat patients and are up to date with the newest medical knowledge. But those doctors themselves are made to pay for revalidating themselves. They also have to pay or take time out of work for doing a whole series of courses in order to start practicing as a GP again. So what we say in UKIP, and this isn't something that's going to be expensive, we say actually the NHS should take that responsibility, should say to people, yes, come back, work again as a GP. We will arrange and pay for your revalidation. These are the courses you have to do, but we're not going to charge you for them, and we're going to do them in such a way as to speed your return to work, because we desperately need more GPs, not just in 5 or 6 years' time, but now. So that is one policy that we have that we believe will allow more GPs to come very quickly back into the system. In Medway, I think we have a particular issue with the shortage of GPs, and there's no system of GP appointments that's ever going to be perfect. But I heard a few months ago that elderly and frail people were waiting in the cold and dark of winter from 7:30 in the morning at one GP surgery in Rochester in order to get an appointment. And when I heard that, I actually made representations for those elderly people and said that it wasn't acceptable and the appointment system needed to be changed. And thankfully, that is no longer happening in that way. I've also come across now, I think, several different constituents who've come to me and said they've had to to wait for 6 weeks or more to get a GP appointment. And again, that is simply unacceptable. We had one surgery in Strood run by Dr. Janager, a fantastic GP at Marlow Park in Strood, that was threatened with closure. I actually stepped in and saved that GP surgery from closure. There are other surgeries where there have been significant issues, and I've been working often on a confidential basis with the various NHS bodies to try and make sure that patients at those surgeries are served in the best way possible. We need, though, to make Medway more attractive for GPs to come and live. And we'll talk in a moment about good quality new housing. And actually we need some of that, not only affordable housing, which is very important, but also attractive housing that makes the best of historic Rochester, and where we can say to aspiring doctors, come and make your career here, look what a wonderful place this is to live. We also need to have sort of work that the GPs are doing that they're proud of. One area that I've been involved with to a degree, because my father co-founded a charity called Heart UK. And the GPs across Medway have done an absolutely fantastic research project, which means that now Medway has the highest rate of diagnosis for familial high cholesterol of any area in the country. So the GPs have worked together to identify family members of people with high cholesterol, to encourage them to be tested, and then actually to treat that high cholesterol to reduce the incidence of stroke and heart disease. And that's one area which we can be very, very proud of our GPs and our doctors being at the cutting edge of medical research. At Medway Hospital, the problems we've had, I think, have been centred particularly on the emergency pathway and our A&E, and making sure that people are admitted and discharged properly in good time from the hospital. Before I say anything more about the hospital, I would like to say that as our Member of Parliament, for every one person who would come to me with any criticism of Medway Hospital, I would have 3 or 4 who would come off their own bat and tell me what good treatment they had at Medway and how proud they were of the doctors and nurses who treat people there. Too long, the accident emergency has not been fit for purpose. It hasn't been an environment that we can properly expect doctors and nurses to work in and give of their best, and it hasn't been the sort of environment where we can really expect patients to say, this is where your treatment should be, and it should be of the highest quality. So one of the things I'm most proud of since I last spoke in this hall, and that we've achieved since the by-election, is to have a confirmation, and I believe through lobbying and pressing the campaigning I've done, actually going back 3 or 4 years now, has played a significant part in this. We've helped secure £13 million to rebuild our A&E. We already have a new children's section of the A&E which is open, and by the end of this year we should have a full rebuild and refurbishment of that accident emergency, which I think will give the doctors a real chance to have a facility that works and delivers for patients. I'm also campaigning for another £20 million of capital investment to build what they call an emergency village around the A&E, of short-stay medical wards, so that people who don't need to be admitted for a long period can be treated and then quickly discharged from around the A&E where they've had their initial treatment. So that is a major focus for me, because I know it's a major focus for many, many people that I speak to in the constituency, and that is backing Medway's NHS and turning around our hospital and getting people the medical treatment that they deserve. The other area that's been a particularly major focus for me since the by-election is housing. And I'm ashamed to say that at the moment, Medway Council does not have a local plan. It's years and years out of date, the previous regime they had, and we are left vulnerable to speculative building and development in areas where no one would want to see development, because Medway Council has not managed to crack heads together to do the planning and actually to come up with a sensible proposal as to where housing and other development should best go in order to help us grow and build the Medway towns while protecting our green and precious spaces. One thing that UKIP councillors, after May the 7th, however many we are able to elect, will make a key priority is to actually develop and develop quickly a coherent local plan that properly balances the needs for housing against the needs for environmental protection. And as part of that, what we would like to see is to see that as a bottom-up, locally driven plan without the top-down housing targets that are imposed from central government. I was shocked back at the 2010 election that we had to build a minimum of 815 houses per year, and that was set by central government. I had thought that Conservatives would have changed the system and allow localities to decide with a financial incentive for development, but nonetheless the decision being made locally. That hasn't proved the case, and now under a Conservative council and a Conservative-led government, the minimum housing requirement which Medway is forced to build, whether it's in the right place or not, has gone up from 815 houses a year to 1,000 houses a year. Now there are areas in the Medway towns and in the constituency of Rochester and Strood which I think actually are very good for housing. One of those is Rochester Riverside. We've got a fantastic facility there. We've got a new station going up. I was privileged to be the guest of Network Rail just last week. A long campaign I've had is to get more of the fast morning commuter trains to Victoria and Cannon Street to stop in Rochester. That should now be happening when the new station opens in December. We should also see some of the train times immediately speeding up by a minute or two to London. But what I learned last week is actually once they get the new signalling and points all the way from Swanley to Sittingbourne, once that's working, once that's been tested, they can show how robust it is, they can get trains moving faster, increase line speeds, and there should be the prospect over time of trains being 3 or 4 minutes faster to London in many cases. You can hear a train just in the background as I speak. But what we can use that for is it's an incredible opportunity to regenerate Rochester. And we're now going to have a single developer who's been given the opportunity to complete a vision jointly with the local authority for how that development will look, with good quality family homes, not lots of 1-bedroom and 2-bedroom flats, but family homes as well, some of which will be of very high quality. We're going to have hotels, we're going to have a primary school, we're going to have retail and restaurants, and the key thing is to link that through into Rochester High Street, so it becomes the shop window to attract people to Rochester, both as tourists, but also to come and live and to build businesses and to make a success of our community. I also helped secure some flood protection money, which means we should be able to build more along Strood Riverside. I believe the key for that is getting Strood moving. I have a campaign of 4 proposals for speeding up the traffic and making sure it flows better in Strood. There is money available to do that, but actually it's a question of political will and getting the right ideas and making the changes to the traffic system so people can get home from work more quickly, spend time with their families, and we can attract business to the area by making it a more attractive place to invest. Chatham Town Centre also offers, I think, huge opportunities for not just the retail and sort of office development, much of which is empty at the moment. I would like to see a much better realm of residential development in Chatham. We do have a desperate need for affordable housing, but I'd like to see that balanced with some more aspirational housing that would attract better off people who would be commuting from Chatham Station, so we have a more mixed community. That would mean we would have a wider range of shops, and we have a river frontage, and we have pretty good travel times to London, and we really should be able to make that a much, much more pleasant and attractive area of the Medway towns than we do at the moment. So again, I would look to Chris and his colleagues to inject some new ideas into the planning system to attract that investment into the Medway towns, Rochester, Strood and Chatham. Now, one thing we want to do nationally within UKIP to resolve the pressures between the demand for housing and the need to protect our green fields and spaces is to have a far greater emphasis on brownfield development. Now what that means is previously developed land that's already been used for something else. Why can't we bring that into use so we can have housing in those areas rather than concreting over new areas of the countryside? And some of our ideas to do that, we want to have a national register of brownfield land that is in public sector hands, and grants for developers of approximately £10,000 per housing unit to clean up, decontaminate and remediate that land. We would also, any area that's on that register, new houses built there up to £250,000, we would make free of stamp duty on the first sale. We would also provide indemnity insurance to the developer if there was any problems with contamination that later emerged, and the public sector is much better able to insure that than the individual developer. And we would also, and this is an idea I put forward and has been accepted in the UKIP manifesto, is at the moment we have something called the New Homes Bonus, which I thought was a good idea that the current government brought in, whereby if a local authority allowed development, it would be able to keep the council tax on those houses for the first 6 years. What we want to do is to change that and say that where the development is on brownfield, the local authority can keep the extra council tax beyond 6 years. So that would give a bit further financial incentive for local authorities to develop on previously developed land, and should also be good for Medway because we have lots of sites and opportunities where that would work, so we would get financial support for that regeneration and development. I hope that those ideas will allow us then to protect the Hooper Peninsula and our other green spaces in the green belt. I helped lead, I had a campaign back even 10, 12 years ago when the previous Labour government looked at the cliff option for an airport. And then this current government, I'm afraid, looked at a grain option for having a massive Thames estuary airport in this area. So I led the campaign to fend that off. I believe we'd succeeded. It's been ruled out with thousands of pages of technical studies showing exactly how unfeasible such an airport would be and how ruinously expensive it would be to the whole economy. Yet unfortunately we have in Boris Johnson someone who won't take no for an answer. Even this week he's been giving interviews saying he still wants to see an estuary airport and that's his key political priority that he's going to be pushing. And David Cameron has now said he's going to stand down after the election, and Boris Johnson is the favourite to take over from him. So for all those reasons, I ask you to support me in protecting our Hooper Peninsula and standing up to that, to keep our rural and semi-rural communities and unique landscape as they are, and to have the right balance between our urban areas and that green lung and space for us to escape to. Similarly on Lodge Hill, I just don't believe it's right to build 5,000 houses in a bird sanctuary. There are far better places for development, and one reason why I left the Conservative Party and joined UKIP was in order to oppose that development at Lodge Hill. Now, the situation we have seen is that every single member of the Medway Council Planning Committee, Labour, Lib Dem and Conservative, including from the Rochester Strood constituency, voted for those 5,000 houses at Lodge Hill. Even as we speak, the Cabinet of Medway Council is authorising and instructing lawyers to spend tens, possibly hundreds of thousands of pounds of your money in order to defend the council's decision to develop at Lodge Hill. And that's why I appeal to people that it is me as an MP, Chris and others as councillors, we in UKIP will stand to support and protect that Hooper Peninsula and to stop that development. Now, since I made the decision to switch parties, I've faced some brickbats. I was told, I think, by the local Conservative chairman and top Tory official in Kent that my family should be ashamed of me. I was told that I should be made unwelcome in Rochester High Street. I even had an attack leaflet that was distributed across the whole constituency saying I wasn't fit to be the MP because I'd gone to school in Wiltshire. It didn't mention that I'd gone to school and the Prime Minister's wife was in my class. It then went on to say that I'd studied politics at university in Oxford. It didn't go on to mention that the Prime Minister studied the same course at the same place. And worst of all, it said I shouldn't be the MP here because I'd grown up in South East London. Ignoring the fact that I think we have many, many thousands of people who, like me, have come down to the Medway towns from South East London, and I've now been here 15 years, so I hope that's sufficient to make me local. But what I do is I just try and represent people to the best of my ability. Since I've been the MP, I've helped up, I believe, around 8,000 people, and I always try and look at each case on its merits. I always try and look at each law on its merits and decide whether it's the right thing and whether it's the right thing for this constituency. So that is what I'd like to ask your permission to carry on doing on May the 7th. Chris introduced me saying I was independent, and I say that in my literature as well. Clearly I'm a member of UKIP, but the thing about UKIP is we don't have a whipping system. So it is entirely up to me how I vote. We have a manifesto, but both for the local council group and for Parliament, we look to the individual elected representative to stay loyal to their constituents and to vote in their best interests. And that, I think, is the way we should conduct politics in this country.
Hear, hear.